Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita
Good
Valens.
afternoon.
Yeah, whatever it is, nighttime,
And
morning,
good evening.
It's all good.
So how are you today?
Did you know that a cosmetic surgery used to be such a taboo subject? But
Yes.
now you can talk about Botox and nobody even raises an eyebrow?
Yes, and men are interested in this as well.
You know, we do that stuff at our office too. I mean, we're here to live it up first, right?
Yes.
But also to heal musculoskeletal pain. So we take care of everything. This is called regenerative medicine, by the way. We take care of everything from neck pain, sometimes headaches. Sometimes headaches can be helped if they're coming from trigger points in the back of the neck or the back of the head. And the thing that pops into my mind is almost every patient who comes in from other doctors, because I get lots of referrals, have a wrong diagnosis. Did you know that, Nita?
That's a lot of patients diagnosed incorrectly.
It is. And the reason is because most doctors look at images to decide what's wrong. And we know now, with all the research that we've done, that images don't really tell us where the pain is being generated from, which is a travesty because most of the musculoskeletal surgeries that are done today, in my humble opinion, should not be done. I'm going to give out the phone number. Would you mind?
Let's do it.
Let's spice it up a little and get some callers in here.
Yes, otherwise you'll torture me with jokes
I will.
and riddles that I rarely have the answer to.
No, but sometimes you have your thinking cap on. Let's see if you do today.
Oh, okay.
What do you call someone who immigrated to Sweden? You'll never get it.
I'll never get it.
An artificial sweetener.
Oh,
See?
yeah, I would never have thought of that.
No, but when you think about it, you would have known, right?
Yes. All right.
Did you hear
Moving on. The phone number is.
Okay, we'll get to the real business here. We're here to help heal your pain, and the way you can do that is to give me a call right now and talk to me on the radio. You can use a fake name if you're shy or talk about your relatives or your friends. And the phone number right here, right now. Get a pencil. If you're driving, pull off to the side of the road. Get off your Bluetooth. The phone number is 866-870-5752. I'm going to repeat it for everybody. 866-870-5752. Nita, would you talk to the studio about getting a better phone number for me? That's hard to remember.
I'll work on that. Yeah.
866-870-5752. If you want to get a hold of me at the office, and there are people there right now, if we don't hit what your questions are, you can call the office and get more complete information. That number is easy. That's 800-300-9300, 800-300-9300. If you do call me right now at 866-870-572, I'm going to send you a free copy. We'll even pay the postage for my book, which is called, Nita?
It is called Living Pain Free. Oh, no, sorry. Stem
That's the old
Cell
book.
and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. But I need you to give the phone number again because you left a number out, okay?
Ooh, 866-870-5752. Call me now. Or, if you are shy, hope you're not, go to my website. You can watch me doing videos of all these procedures and see if it's something you'd rather do than getting a surgery. We like to, what do we used to call it? Take the surgery out of pain. Do we used to call that? Or
Yes,
take the
that's
pain out of
true.
surgery?
That's true because, I think there's like this very strange thought that people have that they're going to decide to get an elective surgery and insurance is going to pay for it, which in most cases might be true. However, you don't think about the personal costs, like the recovery time can be horrendous.
Not only the recovery time, Nita, but many people come out worse. I'd say there's a batting average of about 50% better, 50% worse. It's a lot somewhere in the middle, I guess. But I have a very jaundiced eye about surgery. Number one, because I had one on my shoulder in my 4th year of medical school when I was doing orthopedic surgery. Loved my boss. He did a great job, but the shoulder came out bad. It was all swollen, had a fever, and it took about 4 years before I learned about regenerative medicine when I was at my residency at UCLA. And a doctor came in and described what he called pro-low therapy back in the day, just using concentrated sugar water, dextrose, to inject and heal. So I went home and I tried that, and I did my wrist first, actually. That healed up nicely. And then my shoulder, after I injured it in a weightlifting injury. And the wrist healed about 50% overnight. My shoulder healed 100% overnight. And at that point, I started doing this for a living. I stopped sending people to surgery, and I don't want to put down the physical therapist or the surgeons because they do great work, but I don't find that those things work too well. You know, it's not a negative statement, it's just the truth. I get way too many people who get hurt in surgery, and you'd think it's the opposite. You'd think you're going to go to surgery, there's an end point, you go in on a Friday, by Friday night you come out, you're supposed to be great, but there's just too many people that come out worse, and unfortunately there is, like you said, a cultural aspect to surgery, thinking it's a great thing because it is what's being done, and in my mind it's being done way, way too much. So
Absolutely.
I'm going to go to some questions here and
Okay,
spice up the show.
do you want to give the phone number again?
Yeah, give me a call. I'll send you a free book on platelets and stem cells, which are the hot topics today, PRP and stem cells for musculoskeletal healing. It's not going to heal everything, but with the properly chosen patient, it works great. I've used it on my right wrist, both of my knees, and I self-inject, by the way. I use an ultrasound so I can see into the body. Done both my shoulders. I've had other people do my neck and back a few times, and I'm doing good. I'm doing really well, by the way. My body is feeling great, and every place I've injected, I've pretty much healed up. So one more joke to torture Nita until you call up.
Oh, dear. Okay, I'm ready.
Nita, have you heard about the one about the corduroy pillows?
The what pillow? I didn't hear that.
Corduroy.
Corduroy pillow.
It's making headlines.
Oh, my God. Okay, our number is 866-870-5752. I don't think we gave the website yet.
I did, but I'm going to give it. No, you're right, I didn't. The website I talked about, but the actual browser address is www.lastemcells.com. www.lastemcells.com. And if you go there, you're going to see tons and tons of pages of research, which we do in our office. I've had probably 50 medical students or pre-med students who want to go further in their career, so they do research, and that helps them get their next job opening or get into school. Actually, I've had tons of high school students and even some grammar school students who want to become doctors who do what's called shadowing. They follow me around, and I do something called pimping. It's not in the negative sense. It's something that's done very deeply in medical school. It's questioning. And I ask questions, and whatever the student doesn't understand or know, I have them carry a pad of paper with them, and they write that down, and then overnight they research it and come back the next day and explain what they found out. So they always say, can't you just tell me the answer? And I go, I could, but then you're not going to learn anything. If you go to look up one subject, let's say meniscus in the knee, or rotator cuff in the shoulder, while you're looking for that, you're going to find 50 other things and learn all about everything. So we had a couple callers that got off the show, but I hope you guys call back. And I'm going to go to some questions now, Anita, if you don't mind.
Let's do it.
Let me see. Where are my questions hidden on my computer?
Okay, while you search, I'll give the phone number again. It's 866-870-5752 right here in the studio.
Here we go.
I mean, it's like getting a free consultation with you. Who doesn't want that?
I do.
I might go in the other room and call. I got problems.
Actually, it's funny. I deal with a lot of spiritual issues that come up in the office, too, which is fun. That makes it really fun to tie in the medical and the spiritual together. But at any rate, this person wrote a question that says, and by the way, on the email, to get my email, you go to my website, www.lastemcells.com. There's a spot on every page where you can email me, and I get emails all over the world, from all over the world, all day, all night, and I love answering them. So this one's very simple. It says, I would like a copy of your book. Okay, I'll send it to you. A friend of mine had your treatment, did very well, and highly recommended looking into this possibility for myself as well. I have a meniscus tear in my knee, and I'm looking for alternatives to surgery. Well, God bless you, because you came to the right place. And, in my humble opinion, these surgeries are not good things for people. They take out tissue, and whether you have a meniscal tear, rotator cuff tear, labral tear, whatever it is, you don't want that tissue taken out. You want to heal it. And the way we do it is what's now called regenerative medicine. We regenerate the tissue. We grow the tissue. And I use platelets from the blood, and that's called PRP. It's getting pretty famous out there. Athletes have been doing it for years. And then for people that need things for quicker healing or more complex injury, we're going to add stem cells to that. And very simple procedures. I have had meniscal tears in both my knees, and I just went running yesterday. I'm probably going to go running again this afternoon. I live in the mountains, so it's a tough run, but I do pretty darn good. So I've injected my own knees with platelets and stem cells, and have done very, very well with that. So the meniscus tear that you have, I don't see as being an issue at all. There are cases where the meniscus tear is so huge that it has to be sewn back together, which might be something like a bucket handle tear, that's called. But even with that, sometimes it's not an issue. If your knee is locked and you can't move it, you might need surgery. But most of the time people come in, they say, I've been to a couple surgeons, they all say I need surgery, and then we heal them up anyway without surgery.
Yeah.
Nita, you want to say
sense.
something? I can hear you breathing.
Well, I just love when you distinguish for the listener the vagaries of surgery versus regenerative medicine, because you have some rules for people that take the treatments, but the rules are very simple because you treated me twice. I just kind of want to out myself for a minute here for new listeners that both times I'm a quick healer, so I healed within a week. The first time I'd had pain for 18 months. And I cannot underestimate the importance of really doing research and talking to you, because you do regenerative medicine and you've been on both sides of it. You were actually going to be a surgeon.
Yeah, I loved orthopedic surgery. To be honest, it's very fun to do it. And it's very immaculate. Everybody knows their job really well. The nurses, the surgeons, everybody in there, the anesthesiologists. It's like a symphony. So it's an amazing thing to experience. But I just started seeing terrible results from it, including my own body. So I switched horses midstream, and I moved from surgical residency to what's called physical medicine rehabilitation. And I actually taught this at UCLA for 20 years. I just asked them if I took a sabbatical, and just recently asked if I should come back and keep teaching. So we'll see what happens with that. But at any rate, I'm going to go to another question here.
Okay.
And this one is, let's see. I have chronic neck pain, likely in part related to whiplash injury in 2011. That's a long time ago. I live in Colorado and wondering if I should make the trip and how long would I need to be in Los Angeles to get my neck pain diminished or eliminated. So, yeah, that's good. I get people flying in from all over the country, all over the world. And I just had a woman fly in a couple of weeks ago from Hawaii who is an outrigger canoe paddler. And with the positioning they get into, she wore her left hip out and had pretty severe arthritis there. And we did 2 treatments. She was there for like 4 days. We did 2 treatments on her hip. And she just texted me she's all better and wants to know if she can go back to paddling again. And I said, be careful, start slow, because the biggest failure rate that I get with patients is they're so active, they don't really let the tissue grow back enough before they start their sports activity again, or gardening or whatever it is, walking, hiking. It really doesn't matter. The thing that causes the problem, if you keep doing it, what do you think is going to happen? Even if you're healed, you can come get back to that same issue again because you haven't completely healed. You may feel better. And that's the biggest failure rate that I get is people that are too active too soon. The other failure rates are, this is from, I'll say bad doctors who don't know what they're doing. They've taken a weekend course or something like that. I've been doing this 25 years, and honestly, I learn new things every day I'm doing it because I do it all day long. Then there's a lot of doctors that don't use an ultrasound. They'll inject a shoulder one time without an ultrasound, and then the patient comes to me and goes, how come it didn't work? When I do a shoulder, I'm going to use an ultrasound to see where the needle is going to go. And I generally am going to poke all of the rotator cuff tendons. There's 4 of them, and I'm going to do it in many places. I'll hit the subdeltoid bursa. I'll hit the glenoid joint. And I do a very comprehensive type of regenerative medicine because the orthopedic surgeons are great at surgery, but they're not great at regenerative medicine. So they think that it's like injecting a steroid, which spreads all over the place, and then the results are poor, and then they don't believe in it. So you don't go to me to do orthopedic surgery. You don't go to an orthopedic surgeon to do regenerative medicine. So keep that in mind. I always tell people when they come in for referrals, whether it's for kidney disease or some kind of rheumatological disease or whatever that is, I refer them to the guy who I know who does the most of those issues, not someone who plays around with it. So anytime you go to a doctor, make sure, even if it's a surgeon, let's say you're going to get a surgery, you don't want to do this, call them up and say, how many of these surgeries did you do today or yesterday or this week? Because there's a lot of surgeries that are done that never should be done. And the surgeon who's doing them doesn't do many of them. And we had one of those with a young golfer. He had graduated on the golf team in college, and he was going to go pro. And right at the very minute that he was ready to go pro, he had a very bad sprain of the clavicular sterno joint that's in front, and from swinging too hard. And his swing took big divots. Divots are pieces of dirt. And he just, in a sense, dislodged that joint from the sternum to the clavicle.
Ouch.
And yeah, not only ouch, but it would click when he would move it. It was really the ligament that held it in place had torn. So he'd been to a bunch of surgeons, and they said it's a very dangerous surgery because the aorta is right there, and they could rupture the aorta or tear it. So they suggested probably not a great idea to do the surgery, although we did have a couple guys who said they would do it, and someone referred him to me. I said, don't do the surgery. It's a dangerous surgery. You don't need a surgery to fix this. And we worked on him. We did platelets first, and then we did stem cells, and he's back on the tour.
Excellent.
It took a while, and be honest, it wasn't an easy healing because that joint is so mobile. Every time you move the arm or the shoulder, it moves it around. So some injuries are very difficult to heal. That's one of them. But he's been fine ever since. It's been, I don't remember, 3-4 years.
That's great.
Since maybe 5 years since I've seen him. And I see him on Instagram all the time swinging like a maniac.
Great.
So I know that he's done well.
Well, why don't we check in with John in Long Beach?
Hey, John, Dr. Marc Darrow, I understand your spine bothers you. And can you tell us which part of your spine it is? Is it the
First of all, I just want to say I really appreciate what you do. You're really kind of leader in your field. I did a little research, and it's pretty, well, you've done a lot for regenerative therapy, so I appreciate all your work.
Well, I appreciate you telling me that. I've actually started doing this stuff when I was a resident at UCLA, and it's been a godsend for my body. I have to tell you, if I didn't know about this, I'd basically be crippled because I'm a sports junkie, and I do sports hard and repetitive. And when I was I'm 74 now, and I'm more active now than I was when I was in my 40s, when I had so many injuries I couldn't do sports. And then after a lecture at UCLA by another doctor, I started doing this on myself. And I've had to do it a bunch because I keep injuring myself. I'm an idiot. I'm a sports idiot. And you can't tell an athlete not to do their sport. It just doesn't work because that's where we get our high from. I don't do drugs. I don't have a mistress. I live a clean life. I meditate an hour a day, and then I do sports. And, I'm going to be honest, I injure myself. So,
but you're keeping yourself active, which is what you need to do, especially as you get older. So,
well, I think activity is the key to life. And I get people come in, new patients come in every day, and they go, "Do you think I should stop doing what I'm doing?" And I go, "I don't think so. I think if you do, you're going to let the old man in or the old woman in, and that's not what you want to do. It's through activity that we gain endorphins and we feel good about ourselves. And it doesn't have to be sports. There's a lot of activities we can do. Walking is a great sport, you might say. Walking is a big deal today. On the iPhone, there's an app, a health app, that shows how many steps you took that day. And that's important. We have to stay active. So, John, what's going on with your spine?
Well, it's funny that you should be talking about walking. That's a major issue with me. I go into my HMO, they did a MRI, and they said I have arthritis of the spine, I have a bulging C4 and C5 disc, and I have spinal stenosis.
Okay.
And it gets so bad, I have to use, I'm about to retire in 5 months from law enforcement. Okay. And so it was on my right side a couple of years ago. It stopped, and now it's on my left side. It gets so bad, I'm walking with a limp, and I have to use a cane. So I was wondering if regenerative therapy might help those issues.
Well, it might, but I have to examine you first. I don't believe your images mean anything at all. People with bulging discs, that's almost everybody on the planet as you get older, but not everybody has neck pain. So your C4, C5, or whatever it is that's bulging means 0, and stenosis means 0 unless you're having arm or leg numbness, tingling, or some kind of paresthesia or weakness.
Yeah, it is. My left leg goes completely numb.
Okay. Left leg is numb. That could be from stenosis, but usually it'll be both limbs. Okay, it could be one. So we have to look at that and see what's going on. The arthritis means nothing also because almost everybody gets arthritis when they get older, but not everybody gets pain. And I just have tons of patients who come in with arthritis and they're ready for a joint replacement or surgery of some kind, and we heal them up just by using platelets, PRP or stem cells. So, yes, there's a good chance we can help you, but no, I can't tell you right now without an examination.
Right.
John, please stay with us. We're going to go to a very short break, and then we'll talk some more. The number to call me at right now, if you want to talk to me, is 866-870-5600. 5752. And if you call in, we'll send you a free copy of my new book.
And you don't even have to pay postage. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.